Alright, so this is the prolonged stretches of the wrist for wrist flexion and extension. So if we want to increase wrist extension, we must stretch the wrist flexors. So I ask the patient to turn their hand down towards the table and then bring their fingers up towards their forearm actively. They will then grab their other hand and pull those fingers back towards their forearm until in range. They can then hold that for about 30 seconds for about 4 to 5 bouts. Once we have stretched those wrist flexors to increase wrist extension, we can then have the patient actually rotate their forearm so that the belly of their forearm is facing up. To then increase wrist flexion, you need to stretch those wrist extensors. So I ask my patient to bring the palm of their hand up towards their face, and then they will then use their other hand to stretch the wrist extensors even more. Again, they can do that for about 30 seconds for 4 to 5 bouts to increase range of motion of wrist flexion and extension.